Dental bridges are a typical dental procedure to substitute some or all missing teeth. They're basically a false tooth or teeth which are fixed by a connection to adjacent teeth or to dental implants. There are many different kinds of dental bridges, each one having its own advantages and drawbacks. In this clip, we'll explore the various kinds of bridges used in dentistry and talk about the benefits and drawbacks of each. The traditional dental bridge is the most commonly used type of bridge utilized in the field of dentistry. They comprise an artificial tooth or teeth fixed in position by the crowns, which are attached onto natural teeth each side of the gap. The bridges are sturdy and durable and will endure for years provided they are maintained. They do, however, necessitate that the natural teeth be cleaned to make the bridges fit, which could be problematic to some patients. They are akin to traditional bridges, however, instead of being fixed to two sides, they're only connected to a single natural tooth. This could be beneficial for situations in which there's just one adjacent tooth that's strong enough to sustain the bridge. However, these bridges do not have the same stability as conventional bridges and can be more vulnerable to breaking out of alignment or damaging the tooth supporting it. Maryland bridges, also referred to as resin-bonded bridges, offer ones that are more conservative and doesn't need the tooth's natural ones to be removed. The fake tooth can be held in place by the wings of either porcelain or steel connected to the back of nearby teeth. Maryland bridges require less effort as traditional bridges. However, they're less durable and are not suitable to replace gaps that are larger or to support chewing forces that are more powerful. Implant-supported bridges offer a newer and more sophisticated option to substitute missing teeth. They are not attached to neighboring teeth. These bridges are anchored by dental implants, which are surgically inserted into the jawbone. Dental implant-supported bridges offer the best and long-lasting choice, as aid in preventing osteoporosis and protect the health of adjacent teeth. They are, however, the costliest option and will require a more lengthy duration of treatment. There are various types of bridges that are available for use in dentistry, and each has its particular advantages and drawbacks. Your dentist will collaborate together to choose which bridge is best that meets your particular needs and budget. It doesn't matter if you opt for a conventional bridge, cantilever bridge, as well as a Maryland bridge, or an implant-supported one. Making your smile look better with a dental bridge will enhance your dental health and boost confidence.